4 more people have been tested positive for coronavirus, bringing the number of the country's confirmed cases in the country to 18 in 1 week, according to the Ministry of Health. They've had been under institutional quarantine in the various hotels identified by the subcommittee on quarantine and have been evacuated to Mulago National Referral Hospital. The 4 reportedly arrived in Uganda from Dubai, United Kingdom, United States, and Afghanistan respectively.
So a 31-year-old male who arrived from Dubai on 20th March, so he was received at the airport on 20th March and is currently under quarantine. He presented with signs and symptoms of COVID. So this is one of the cases, you remember, the Dubai cases. So he was really not picked at the airport because we were not picking Dubai cases. These are cases we called back from the community and they came in Mulago. We took their signs and symptoms, and as a result of that, the health workers or the specialists at Mulago suspected the case, and we took off blood, and it turned out positive in Entebbe. So that is the first case. The second case was actually coming from UK, United Kingdom, came in via Netherlands, and that must have been on KLM, and was currently under quarantine. The third case is a 48-year-old female who also arrived from USA, and as you know, also USA, like UK, was among our Category 1 countries. This one came in via Istanbul and is currently under quarantine. So the story of this one is the same as case number 2. The fourth case was a 55-year-old male who arrived from Afghanistan. This was a person who called in and said he was not feeling well and he was suspecting he could be having a problem and came in. The specialist concurred with him that the signs he presented were similar to those of COVID, so they took blood from him, which turned positive. So all these patients are being transferred to hospital, or have been transferred to hospital, except case number 4 who was in Hoima. So we have got in touch with him, and we have sent an ambulance to bring him from Hoima to Mulago. So these 4 cases were out of 197 who were tested yesterday.
The Director General Health Services, Dr. Henry Mwebesa, says all previous 14 cases are in suitable condition and feeding well at Entebbe Grade B, Mulago National Specialized Hospital and Adjumani General Hospital.
The 10 cases at Entebbe Hospital are stable and they are doing very well, except one who keeps getting fluctuating temperature. I think I mentioned the same yesterday. The temperature is still fluctuating. At one time it is okay, at another time it is down, another time it is high. But by and large, they are all doing well. 6 in Mulago, they are also doing well and stable. And this includes the 2 Chinese, because some people have been passing rumors that the Chinese are still in the hotel. I want to clarify and categorically state that they are in Mulago. And also this includes the child who came from Wiganga. The case of Adjumani is still in Adjumani and is being managed in Adjumani.
The ministry has so far screened 279 people out of the 574 returnees from Dubai and other countries. The ministry has also expanded the 24-hour call center to 120 agents for quick response.
It is a sunny afternoon at Namuwongobi zone in Kampala. Everyone is busy, going about their routine, with the women and men engaged in various ventures. In these endeavors, however, there is one thing that has not escaped their minds: the outbreak of coronavirus.
Yesterday I went to one of the places where they are washing the hands. Someone just came and put the hands and then just did like this, then that's it. I tried to talk to someone, then the guy was like, no, so when you look around, people are just like, they want the money other than their lives.
Also known as COVID-19, guidelines to its prevention have attracted some lamentation from some residents. They claim to find it difficult to adhere to the recently issued guidelines in fighting the virus. One such complaint is raised by youthful Ben Mopuya, a private security supervisor.
I'm requesting the government, maybe by tomorrow at around 10, I'm moving with my woman when we are fully in uniform with my luggage. I'm going to Mbale. I'm coming back after 14 days I've finished.
His grievance is shared by aging Joseph Adoku, who wants a revision on transportation restrictions recently put on taxis and border borders.
I want government to allow us free means. Give us free means and you move. Others who are not sick, we want to move. We have our money. That is my problem.
But why protest the guidelines? After all, it is for everyone's good. We sought such answers from a visibly supportive businesswoman to the cause. Even when she treks a number of kilometers to work, youthful Christine Kwagala is welcoming to the measures recently issued by government to fight coronavirus.
Abantu aba bakyagoberera mateeka ago bannange nze mbadde mbasaba mugoberera amateeka aba batawa abantu distance naye mbadde ndaba nga wano twewaddewaddemu yadde abamu bazzeemu naye luli twali tweweredde ddala distance ng'obwo obutale bwonna busembedde eno lwakuba bazzeemu ne beegatta wamu naye mbadde mbasaba bannyabo abanda mu butale tuddemu we nga we twasooka.
People here are really not very safe. Once we get one victim, we know that more than 200 people are going to be affected because they are in contact with each other. And you hardly find someone covering himself with a mask. So we are really at high risk.
It is such concerns that have caught the attention of many stakeholders, ironically, including sex workers. Diana Natkunda is the executive director, Women's Organization Network for Human Rights Advocacy.
As Wonetha, we call upon all the lodge owners. They should allow the sex workers to leave their premises so they can also work together to fight the COVID-19. All sex workers should stay at home and stay safe.
Currently, Uganda is home to 18 COVID-19 patients recently reported in the country, including an 8-month-old baby. A number of countries, areas and territories have recorded several cases in the ranges of tens, hundreds and thousands, with recent figures indicating United States to have surpassed Italy.
The degree of compliance in regard to washing of hands with soap and water in most of the markets in Kampala and suburbs is high. In most markets, they have put boundaries to entering the market, not until one washes their hands.
Nobo nabye wali ebusibu tusanga oli akugamba nagamba nti nabye wali sigenda kudamu kuna no mugamba naaba nsikulabye naaba nga tonayingira katale
okubeera nga tunaaba buli kiseera kyekyo twakisiimye era tukubiriza nnyo abantu wano banaabe tuweme kubanga tufuna obulwadde.
However, Kalere Market continues to be crowded with vendors dealing in foodstuffs, vegetables and fruits. Vendors' competition is now the challenge to maintain the 4-meter distance per stall per the Ministry of Health guidelines. Although vendors in Kalere Market testify that the leadership is trying to space them, the market is small, affecting implementation of the 4-meter distance.
Twachekozemu fefeka kuba chairman wa Africans badri yatugambye twewa mabanga era badda tugewa
kintu ekyo ndabanga omuntu okwewa gap ezo muno yeye nalekawo y'omudala gwe n'agenda yagenda muli naye takikoze eki takishimye bulungi akatale katono tusobola kusupesinga gap ejjawo bulungi
muza kutusanga wano mukola kale abantu bangi ekirala buli muntu aba ayagala okubanga ataddewo omulimu okola kati tuwaliwo abamu be tuba tusobola okujjawo oko ne babeera nga tebaliiwo.
Talk to our leaders, the owners of the market, to space those people whom we have seen alongside the road. At least they should follow rules.
At Nakawa Market, the situation is different as vendors enjoy their space following a directive by the president to only allow food items to be sold in markets. However, some of the leadership of this market say it is not easy and want KCC enforcement team to intervene.
A problem because we need the sensitization and we need maybe some stores to be picked out so that we have the space what they need. But the problem it is from KCCA. So it needs a money power to add to us and we do what? The exercise.
Banning of public transport has affected vendors' movements and their customers. Meanwhile, some border riders at Nakawa Market were loading food to transport to different destinations. Some of them appreciate the president for retaining their operations.
Era tiyatuyisiza bubi olw'okubanga ffe yatulekeddewo akaaganya ak'okubanga tusibako emigugu abantu batukubira amasimu ne batwesiga ne batutuma n'ojja n'omugulira ebintu nga bino n'obimutwalira paka kutuuka wakaawe.
Although appreciate the presidential directive on public transport, many vendors say the president would have left borders on the roads to carry one passenger.
The people of Karamoja sub-region in northeastern Uganda still upholds African tradition and culture of eating and drinking in a pool and regularly shake hands. According to the Minister for Ethics and Integrity, this puts the sub-region at a high risk once the virus spreads to the area.
People have got what we call a socialization character. We live communitarianly, okay? Karamojong will never walk alone and they will always greet, handshake, they will always hug very intimately. So they become more precarious should this virus drop into the soil of Karamoja.
The minister says low sanitation practices coupled with porous border points is another factor.
Karamoja is the most vulnerable. One, it is a place that has very low sanitation percentage. Two, they are also bordering international borders where it is already said the virus has reached. Kenya, the old belt from Amudat up to Moroto is having bordering Kenya, actually up to Kabong. And then the entire Karenga district is bordering South Sudan.
Similar concerns were also expressed by the woman MP for Nakapriprit, Esther Anyakun.
In most cases, our people in Karamoja don't have televisions, they don't have radios. But of course, this should not remain at only these media houses. I would also want the LOC ones of each village to take up this responsibility to make sure that they sensitize people in their villages because our people believe so much in their LOC ones. So this message should go down to the grassroots to sensitize the people about the outbreak of corona, the symptoms, and also the preventive measures for this disease. So to me, it is awareness is not yet so much in the region because of lack of some of these facilities. But
the deadly coronavirus that broke out in China December last year spread through border contact, and Uganda has so far confirmed 18 cases.